Hello, everybody. Progressive Hoodie here. I want to give all of my friends out there some updates about the coronavirus disease, the COVID-19. I know you all are really busy living your lives and you don't always have time to sit down and read this stuff. So all the information I'm going to be sharing with you is coming from the CDC, cdc.gov, and that's cdc.gov/coronavirus/2019-N COVID/about whatever you get it. And so I'm just going to give you some information. First, let's get some updates. So from what I've heard, there's about 126,000 or so diagnoses now of this worldwide. Now, I don't know what the numbers are for the US right now, but I mean, we're short test kits. So, I mean, whatever they may happen to be, I'm sure they're wrong. I'm sure it's worse than whatever it's saying because we don't have the testing capability for everybody right now. And I'm also wondering how that shortage of test kits is affecting our understanding of the death rates as well. Because I mean, how many people are dying and it's just saying, oh, they had some kind of upper respiratory thing or something. I mean, how can you know it's COVID-19 unless you're testing them? Yeah, you don't. So how can we be even sure that those numbers are accurate? So just the intelligent thing to do right now is to just assume that pretty much across the board it is a little bit worse than we're thinking it is. It's so funny too to hear from the government basically being like, oh, everything's fine. Trump's like, oh, don't worry, don't panic, everything's good. We're going to shut down air travel from I don't know how many different countries, and all these different big organizations and sports leagues are shutting down, canceling public events, and they're not doing any debate. Public the presidential candidates are not doing any rallies, and this debate coming up on Sunday is not going to be open to the public. And remember, they wanted to change the format and make it a town hall and ask all these questions. Well, they're not going to do that because they're not going to let anybody in there. So it's just so much going on. It's just crazy. But let's just talk a little bit about COVID-19 so that we can be more informed and stay safe. So how does COVID-19 spread? Person-to-person spread. The virus is thought to spread mainly from person to person, between people who are in close contact with one another within about 6 feet, or through respiratory droplets produced when an infected person coughs or sneezes. Now, these droplets can land in the mouths or the noses of people who are nearby and possibly be inhaled into their lungs. That's why if you stick and you stay your hips home, doesn't say that, I'm saying that. Can someone spread the virus without being sick? Well, as far as we know, people are thought to be the most contagious when they are the most symptomatic, i.e. the sickest. Some spread might be possible before people show symptoms. There have been reports of this occurring with this new coronavirus, but this is not thought to be the main way the virus spreads. Okay? Now let's talk about spread from contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or an object that has the virus on it and then touching their own mouth, nose, or eyes or whatever. But this is not thought to be the main way the virus spreads. How easily the virus spreads. Let's talk about that. So, how easily the virus spreads from person to person can vary. Some viruses are highly contagious and spread very easily, like measles, while other viruses don't spread as easily. Another factor is whether the spread is sustained, spreading continually without stopping. The virus that causes COVID-19 seems to be spreading easily and sustainably in the community spread, in some affected geographic areas. So community spread means people have been infected with the virus in an area, including some who are not sure how or where they became infected. All right, so the situation in the U.S. In addition to CDC, many public health laboratories are now testing for the virus that causes COVID-19. View CDC's, okay, whatever. With this increase in testing, now 19 states have reported cases of COVID-19 to the CDC. U.S. COVID-19 cases include imported cases in travelers, cases among close contacts of a known case, and community-acquired cases where the source of the infection is unknown. My goodness. So there you have that. Now let's talk about the symptoms. Are you wondering right now if you may have it? Are you thinking, oh my God, I'm going to die? Well, we'll help you out here. So, what symptoms should you watch out for? Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease 2019 COVID-19 cases. The following symptoms may appear 2 to 14 days after exposure. Okay, 2 to 14 days. Fever, cough, shortness of breath. You should call your doctor if you develop symptoms and have been in close contact with a person who is known to have COVID-19, or if you've recently traveled from an area with widespread or ongoing community spread of COVID-19. Now, let's talk a little bit about how you protect yourself. Let's get into prevention here. There's currently no vaccine to prevent coronavirus disease. The best way to prevent illness is to avoid being exposed to the virus. The virus is thought to spread mainly from person to person, between people who are in close contact with one another within about 6 feet, or through respiratory droplets produced when an infected person coughs or sneezes. So what are we going to do? First of all, clean your nasty hands, okay? Wash your nasty hands with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing, or I would add, coming within 100 feet of a child. I work with children all the time. I know how they wash their hands. Trust me, I've seen it. It ain't pretty. Their hands ain't getting clean. So you absolutely need to make sure that you are doing it. I like to wash my hands and sing the alphabet A, B, C, D, E, F, G, H, I, J, K, L, M, N, P, you know. And I go all the way through that. Get underneath them gross nails of yours. Okay? Soap and water is preferable always, but if you don't have that, use a hand sanitizer that has at least 60% alcohol. I've been told 70%, but whatever. I mean, use sanitizer with a high degree of alcohol. And cover all surfaces and your hands and rub them together until they feel nice and dry, okay? Now, avoid touching your eyes, avoid touching your nose, avoid touching your mouth. Okay, just stop touching your face, okay? Avoid close contact with people who are sick. Put distance between yourself and other people. If COVID-19 is spreading in your community, this is especially important for people who are at a higher risk of getting very sick, okay? And who are those people? Older adults, for one, and people who have serious chronic medical conditions like heart disease, diabetes, and lung disease. If you have asthma, I've heard people that have asthma are at greater risk. You need to take steps and precautions to protect yourself. Here are some things that you can do to protect others, and we would all like you to protect us. Would you like to protect us? Yes, you would, okay? Because you ain't trying to get that behind whooped, because we going to beat you down if you don't protect us. Now, here's what you can do. Step 1, stay your hips home. If you're sick, don't come. We don't want to see you. We don't want it. We're not interested in seeing you. Stay home. Don't come to work. We don't need your help. Unless you're getting medical care, then you can go out in the public. But otherwise, you need to be at home. Lock yourself down. Cover that cough and sneeze. Ain't nothing that makes me sicker than when people go around. Have you ever seen somebody come around? Just like, what the heck, dude? Cover that. Foul. And when you do it, use your elbow. Don't be sneezing and coughing on your hand and come in and give me a handshake. You ain't getting no handshake. I'm doing this. Yep, bump it. Elbows, all right, yeah. Okay, throw used tissues in the trash. I mean, That should be go without saying. Again, nothing is grosser than people that be. What are you doing? Don't put that in your pocket. Throw that away and get another one. Those are not recyclable. They're disposable. What the heck, man? Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with hand sanitizer. Wear a face mask if you're sick. Okay? If you are sick, now there's a whole lot going on around about the face mask thing, so let's clear that up. Look, if you're sick, you should wear a face mask when you're around other people, but you shouldn't be around us. So just let's put that out there. Now, before you enter a healthcare provider's office, make sure you're wearing it when you're around the people. If you're in the whatever. Now, if you're not able to wear a face mask, for example, because it causes trouble breathing, then you should do the best to cover your cough, cover your sneezes. And people who are caring for you should wear a face mask if they enter the room. Now, if you're not sick, you do not need to wear a face mask unless you're caring for someone who's sick and they are not able to wear a face mask. Face masks may be in short supply and they should be saved for caregivers, okay? All right, that would be a good thing to consider. Now, clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes your nasty tablet, your disgusting doorknob, your yucky light switches, your gross countertops, handles, desk, phones, keyboards, toilets, faucets, and sinks. You need to be wiping that nastiness off every day. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Now that's what we got for that. Okay, so definitely clean your gross house. Clean it up. I see that trash everywhere. You need to clean that. Now, what do you do if you're sick? Well, we've already been into that. I'm sorry. Okay, let's get into some travel info. I'm going to do it in the United States because that's where I live. Should I travel within the United States? That's a great question. CDC does not generally issue advisories or restrictions for travel within the United States. However, cases of COVID-19 have been reported in many states, and some areas are experiencing community spread of the disease. Crowded travel settings like airports may increase your risk of exposure to COVID-19. If there are other travelers with COVID-19, there are several things you should consider when deciding whether it is safe for you to travel. So here are some things you should consider before you travel. Is COVID-19 spreading where you're going? You might want to look into that. Look ahead and see what's going on in this area. And, if it's spreading around there, maybe you don't go there. I don't know, just a thought. Will you or your travel companions be in close contact with other people during your trip? Your risk of exposure to respiratory viruses like COVID-19 may increase in crowded settings, particularly closed-in settings with little air circulation. If there are people in a crowd who are sick, this may include settings such as conferences, public events like, concerts, sporting events. A lot of those are getting canceled anyway. Religious gatherings, public spaces. A lot of people are doing church online and stuff like that. And they're like, I ain't going up in there. Yeah, God gonna protect you. Yeah, sure, He's gonna protect me from home. Public spaces like movie theaters, shopping malls, public transportation, etc. So those are things to keep in mind. Now, are you or your travel companions at higher risk of severe illness if you do not get COVID-19? People at higher if you do get it, I'm sorry. Are you or your travel companions at a higher risk of severe illness if you do get it? People at higher risk for severe disease are older adults and people of any age with serious chronic medical conditions. Okay, CDC recommends that travelers at higher risk avoid all cruise travel and non-essential air travel. Do you have a plan for taking home off from work and school in case you're exposed to it? If you're exposed to it, then good luck. We have, unfortunately, a backwards system in this country where medical leave is not guaranteed at your job by law. Sick leave is not guaranteed. Time off isn't even freaking guaranteed by law. So, and also we don't have anything close to resembling a universal healthcare system. I think there was this nonsense going around. They were like, "Oh, it's okay, but you'll be treated for free. Treatment will be free." No, as far as I understand, the testing will be free if we ever get any. I mean, if we ever get the amount of testing that we actually really should have in this country, then testing will be free. But actually being treated for it will not be free. So good luck to you. Do you live with someone who is older or has a chronic health condition? If you get sick, your household contacts are, of course, going to be at risk for infection. So keep that in mind. And then, of course, look it up and see if it's spreading where you live. So what now? What are you going to do? How are you going to protect your family? Well, prepare your home. Make sure you have a checklist where you're planning ahead, and stay informed. Keep up to date with this. You know, And again, take all the necessary precautions of washing your hands and limiting travel and exposure to this disease. Okay? So anyway, I wanted to share that information because I know a lot of you are busy. So I hope that helped. Please, again, stay safe. Take care of yourself. Wash your hands. If you coughing and sneezing and stuff, back up. Don't come near me and cover that up, and don't come over here and cover your mouth with your chicken wing and throw that in the trash, that tissue. Don't reuse it. And again, don't come over here, okay? Because I'm not interested in it. Thank you so much. All right, have a good day. Deuces.